I wonder if we might start with mental health this morning, however. You're announcing some pretty major reforms to mental health legislation. Just walk us through those.
Well, that's right. Later today in the House of Commons, I'll be setting out the proposals to have a new mental health act. You know, all this last year we've been dealing with coronavirus, but also the changes to the 1983 Act, which currently governs how we support people with serious mental ill health. That act needs to change, and we've been doing the work on changing that, and that's published later today. You know, the act is very much out of date. It seriously needs updating, and I'm really, really pleased that alongside obviously tackling the immediate challenges of coronavirus, including, of course, the mental health challenges, we've been able to do this work. We'll publish the white paper later. And what it does is it gives people extra and increased empowerment over their own lives and how you're supported. And I hope will improve the dignity with which, as a society, we support some of the most vulnerable people who are in the mental health crisis and have a very significant mental ill health.
We shouldn't forget, of course, that it has been a priority for this government since 2011 to get parity of esteem between physical and mental well-being. So hopefully we can see some progress on this. But in terms of those on the front line, I mean, research this morning suggesting nearly half of intensive care staff are reporting symptoms of PTSD, severe depression, anxiety. NHS workers, according to this research, suffering more than combat troops.
Well, this is a very significant problem. We all think about how difficult 2020 has been for everyone. But for those who are working on the front line in the NHS, it's been especially difficult, and it's difficult right now. The pressures of the first peak and now the pressures of the number of people, over 30,000 people in hospital with COVID, and that the increased mortality rate puts very significant pressure on our teams on the front line. Mm-hmm. So we're putting in extra resources, extra money in the here and now, and the legislation is, to be clear, for longer term and for people with significant mental ill health, and rather than necessarily those on the front line. But there's something that everybody can do now. There's something everybody can do to help those on the front line, and that's to stay at home unless you absolutely have to leave, because that's the best way that we can control this virus.
Let's talk then about the very significant pressures on the health service at the moment. Some are estimating that we could be seeing as much as 250,000 new COVID-19 cases a day. The suggestion from the scientists, from those in the health service, I should say, is that the pressure, therefore, on the health service isn't going to start easing any time this side of March. On that basis, a number of your colleagues are looking towards the 8th of March as the point at which we will start to see restrictions being relaxed. That's not going to happen, is it?
Well, it's impossible to know, and we'll keep the restrictions in place not a moment longer than they're necessary, but we will keep them in place as long as they're necessary. On the timings of that, we're on track to deliver the vaccination program to the 4 groups who are most vulnerable to COVID by the 15th of February. That's really good news. The vaccine rollout program is going really well.
Sorry to interrupt. Sorry to interrupt, but can I just for clarity, because there has been a difference on this programme this week as to the target of 14 million jabs in arms by the middle of February. Is that the target? Vaccinations, the first dose, 14 million of those 14 million will have been reached by the middle of February? Or is it just, as Nadeem Zahawi suggested to me on the programme at the beginning of this week, that they will have been contacted by the middle of February?
Oh, no, it's that they will have been, everybody in the top 4 priority groups will have been offered to be vaccinated by or on the 15th of February. That means that they'll have been offered a slot to be jabbed, where that opportunity to get the vaccination is on or or before the 15th of February. That's the precise definition of this target. We've made it very clear so that there's no umming and ahhing about whether we've met it or not. Now, I very much hope that the vast majority of people will take up those offers as well. And in fact, the evidence shows that that there's been quite a sharp increase in the proportion of people planning to take the vaccine, which is great. But I just want to bring it back to the opening point, which is the pressure on the NHS. You know, the measures that we've got in place that we hope to be able to lift, and we should be able to lift when we've been able to protect through vaccination those who are vulnerable. Right now, the vaccine is not yet in a position to do that. We've got to support people
again,
on the NHS.
Sorry to interrupt, Minister. Sorry to interrupt, but you've just said that we want to start easing the restrictions once the 14 million have had their, or the most vulnerable have had their jab. There is a 3-week lag time between the 14th of February and the first week, and the quality of immunisation actually being taken in. So again, this date of March the 8th, on which we are going to start seeing the possibility of restrictions being eased. How can that be possible on that timescale?
Well, I haven't put a timescale on it.
I know you haven't, but some of your colleagues have.
Well, great, but I'm the health secretary.
That is indeed true. That is indeed true, as the words at the bottom of the screen point out. Minister, clearly there is huge pressure on the health service at the moment. The Guardian reporting this morning that we are going to see people released from hospital early in significant numbers and put into hotels. Is that the case?
Well, there are huge pressures on the NHS, and as you'd expect, we're looking to all different ways that we can relieve those pressures. You'll have seen that we're now taking hospitals in the NHS London Nightingale, that is there as backup. But of course, we have plans for in case there's more that's needed. Now, we'd only ever do that if it was clinically the right thing for somebody. But in some cases, people need step-down care. They don't actually need to be in a hospital bed. We work very closely with the social care sector to make sure that capacity is available. But but we look at all options. So this isn't a concrete proposal by any means, but it is something that we look at because we look at all contingencies.
Two words which I suspect strike fear into some government ministers these days. Marcus Rashford, he has again raised concerns about the provision of free school meals. You will have seen the pictures, and I'm sure your reaction will have been exactly the same as mine, that if people are being given what has been shown on social media to cover children's meals for 5 days, something has gone badly wrong in the provision, hasn't it?
Well, yes, clearly, and the company's apologised, and rightly so. And colleagues at the Department for Education have been immediately on this. They've met the company, and the company is sorting the problem out. The food packages that were sent out were clearly unacceptable, it's one of the strengths of social media is that we could find that out so quickly. That was brought to ministers' attention, and they got right on it. So. It's a problem that is being fixed. The company's apologised. I think the good thing is that I'm really glad that we're able to provide these meals and this support to people in what are incredibly difficult times. So I'm very glad that that's been done. This is only one company of many who are providing these food packages, and I'm glad that ministers in the department have been able to fix the problem.
Why is the contract with this individual company simply not being cancelled? Surely there is a break clause. They've clearly not been fulfilling the terms of the contract to which they have signed up. So why are we still using them?
Well, that'll be a decision for the ministers in the Department for Education. But I know that the company have apologised and have said that they're going to sort it out. So what matters is that people get the food that they need to a standard that they deserve, and I know that people are working very hard on making that happen.